We are living longer, but we are not living better. By 2050, 25% of the global population will be over 65, and many will be unwell. As the number of people with chronic diseases increases, the costs of care are crippling governments, businesses, and individuals. Today, our care is fragmented, and our health data is siloed. But that is starting to change. Health is being reimagined in ways that fuse the digital, physical, and biological worlds. Increased customer expectations and rapid technological advances are reshaping the healthcare industry, shifting power among traditional stakeholders and creating opportunities for new entrants. Newly empowered superconsumers are driving this change, calling for more engaging, connected care. As demands for proactive, personalized health increase, data-driven algorithms that improve outcomes will become the most valuable healthcare products. To make this reimagining our reality requires a new, shared approach. One of collaboration, one of convergence. What could a healthier future look like? Meet Sarah. Sarah coordinates not only her own healthcare, but the care of her daughter, Zoe, and her father, John. Using several online apps, Sarah organizes a complicated web of stakeholders who help her manage her asthma and John's Parkinson's disease. She regularly interacts with different care providers for each family member: the pharmacy, the insurance company, and the ride-sharing company that takes John to his weekly health appointments. Because John has trouble remembering to take his medications, a smart pill alerts Sarah and his care team when he takes them. Sensors in John's shoes and his fork also monitor his symptoms. Sarah's smart inhaler tracks air quality, helping her better control her asthma. Unfortunately, the connected devices don't sync easily with anyone's electronic medical record or with each other. Sarah is overwhelmed. Neither she nor the care teams can make real-time improvements in her condition or her father's. A new mobile interface gives Sarah direct control of her family's health records. The app lets her integrate important medical and wellness data so that each family member has all their health-related information in one place. 3 years later, John's Parkinson's disease worsens. In a smart operating room, physicians implant bioelectronic microelectrodes into his brain to treat his disease, reducing the need for traditional medicines. Nanobots injected just before John leaves the surgery center supply a continuous stream of data about his condition to an intelligent alert system. This system notifies John's care team if readings are abnormal. The next day, a technician visits John to turn on the electrode's microstimulator, while John video chats with a neurologist. The neurologist explains how the stimulation will adapt over time based on his brain activity. John's medications, already tailored to his microbiome and pharmacogenetic profile, are adjusted based on data from the nanobots in his blood and sensors on his skin. John's primary care physician reviews the data from the medical, activity, and environmental sensors around the house to monitor his risk of falling. As John's risk of falling declines, his insurance company lowers his premiums. The insurer also develops targeted incentives to keep him active. At birth, Sarah's daughter, Zoe, has her genome sequenced. An array of biological and social data is gathered to create a map of her disease risks. Regular testing over her lifespan provides a more complete profile of her health capacity and risks. This creates opportunities to prevent disease using personalized behavioral nudges. Zoe enrolls in a dynamic health insurance plan that lowers her premiums when she makes healthy choices, such as regular exercise and a nutritious diet. Intelligent algorithms handle claims behind the scenes using a private blockchain. Zoe's refrigerator receives daily biometric updates about fluctuations in her microbiome and orders the right foods from the local grocery store. Her care team stays abreast of these trends, ordering medicines when required. One day, Zoe's profile indicates an increased risk of blood cancer. Doctors prescribe a personalized gene therapy and immune stimulator to destroy circulating cancerous cells. With several months of treatment, Zoe's risk is reduced. Routine at-home monitoring helps make sure that risk remains low. Everyone wants to be healthy, for today and across their lifespan. Opportunities that support health will lead to new products, services, payments, and, ultimately, valuations. Digitally savvy businesses, building on successes in retail and technology, will deliver high-touch care anywhere, anytime. New tools are empowering the consumer. Artificial intelligence will improve diagnoses and accelerate drug development, driving us toward a future that emphasizes prevention. Data-rich, interoperable platforms of care are emerging to meet the challenge of maximizing lifelong health. These platforms will collect, combine, and share personalized health information in real time. Companies from every sector can create an environment for change and shape these platforms, creating new value where industries intersect. Successful organizations will unite around a shared vision. To create future value, it will be critical to understand and influence behaviors in ways that matter to people. As health is reimagined, how will you create value?